New tricks? That's my new trick. Good. Hi, Dr. Ludeman here from Bolingbrook Family Chiropractic. Today I am seeing a 38 plus 3, 5-day pregnant mama. She's ready to get her baby out, baby number 3. So she's a little tired. She's having some low back pain, which is not surprising. Anything else bothering you?
My back.
Oh, and that's right, right side neck, probably from all of the fun sleeping positions that we do while we're pregnant. So watch me as I adjust her, and then I'll talk you guys through what we do when we work on the belly. So you doing any, we're still walking, are you doing any lifting, or?
I'm sitting at the bottom of my squat, but that's it.
How long are you doing that hold?
I'm doing I'm pushing my knees out for 20, and then I hold it for 10 seconds, and then I sit there and just kind of wiggle, and then I get up.
Okay.
But I'm using the rings. I probably don't have to, but I just hold on to stretch my back.
I mean, you're really swollen and puffy in the lower back here, but that's also part of what we anticipate at this stage too, for you to be, as everything starts to move down and loosen and the back of the sacrum opens up, which is not a bad thing, but there's just a lot of edema in the area. Go deep breath in here and all the way out. Good. Deep breath in again and out. Go ahead and stand. And then go ahead, go on your back. Gosh, a little baby belly. Okay, I'll adjust your neck first, and then we'll do our little blurb about the belly.
It's really crampy up here all the time.
Well, not only that, but if you look here, you're still so far right as well. All right, right neck. That's yuck.
I know, it's because I'm sleeping on it. And I don't usually sleep on it.
I also wonder though too, if you're sleeping on that right side, if that's part of it, that you're creating that side lying there, and then you're just getting her to shift a little bit more into that right side.
I think that the right side is also where the placenta is, because that's what somebody told me.
Oh,
that's what 2 people told me. At the ultrasound tech told me that the placenta's over here. I'm not sure where. And then the massage therapist said that the placenta's over there.
So what we're going to do now is we're going to check her pubic symphysis. So this is part of our Webster technique. So go ahead and press in for me. Good. Any pain?
A little bit, yeah.
Yeah, you're a little bit weaker on that. Yeah. And then we're going to go ahead and we're going to check the legs as well. So she's actually shorter on this left side than the right. So when we press in, we should have the adductors that are going to contract. Because this left pubic bone has shifted up like this, that means that she is going to have more weight moving to the right side, and she's going to have more muscle compensation here. So when we're getting that resisted adduction, it's weaker on this side, which means she's overusing this side, which is why she feels pain on the right side, but we need to adjust the left. So in our office, a pubic symphysis adjustment we use with an activator. So we're going to check the top of the bone. Sometimes it's a little uncomfortable, right?
Not too bad.
You're like, it's not too bad today. And then we'll come back and we'll check our leg length, see that she's given another millimeter back. And then we're going to go ahead and I'm going to do my ligament work here. So we're going to be on the side, and this baby is head down and very engaged in the pelvis and sitting right above that pubic bone, which is where we want her at 38 weeks. You okay?
Yes.
Tender?
Yes.
Yeah. It's like... And then for this round ligament release, we're going to press up and hold. So the round ligament is the only ligament in the body that has contractile muscle tissue, and that's so that while we're having contractions, it can contract with the uterus as well. But what happens is when we have imbalance in the pelvis and we have too much muscle compensation on that side, it's going to have a trigger point. So we're going to press and hold, and sometimes it can be a little tender, and we're just going to press and liquefy that trigger point out. And ratchet nails for the internet. There we go, though. Now I'm able to get just a little more.
Abigail's peeking behind you.
Is she? That's funny. How's that feel now?
A little better.
Yeah. I'm sorry. I almost need to like come in and like rotate out a little bit, like you have. Good. Let's go ahead and bring these back up. Go ahead and press in. Good. So strength's improved. Do you still have pain here?
No.
Okay. Good. Perfect. All right. I'm going to help you sit up. So we're going to do one of these. So you're going to go here. I'm going to come up like this. I'm going to come here this way. Ready? 1, 2, 3.
Oh.
I know. Isn't that nifty?
That's a new move.
And then you can sit there. I'll adjust your shoulders with you facing that way. Isn't that cool?
Yeah.
Every once in a while, an old dog can learn some new tricks. That's my new trick. Good. That will help with that right neck pain too. Good. There you go, my dear.